Local programming on KRWG made possible in part by viewers like you. Thank you.
Welcome to Fronteras, a Changing America. I'm Edmundo Resendez. According to a report by National Congress for Hispanic Mental Health, Hispanics are a growing population in size, positions of leadership, and economic impact within the United States. At the same time, they face higher levels of poverty, lower levels of educational attainment, lower insurance coverage, and cultural and linguistic differences, each of these factors which contribute to a greater risk for health and mental health problems. On today's Fronteras, a Changing America, we explore mental health among Latinos in New Mexico and across the country, from stigma to treatment. Mental health does not discriminate. It crosses all cultural and race barriers, not just in this country, but worldwide. Shedding a light on Latinos, who are the largest growing population in the U.S., presents some challenges. Latinos in the U.S. are a melting pot of cultures that come into the U.S. from different countries across Latin America. And when you add in Latinos that have been living in the United States for multiple generations and have become assimilated, you have a population that is not easily a homogeneous group. Dr. Dario Silva at New Mexico State University adds that cultural stigma is an issue with Latinos and mental health.
And I was raised this way. Guilt is runs high in our population because there are things that you're supposed to do. There's a lot of unwritten rules that we have, and this is the way you are. And if you're not that, family shaming the family name is like a big no-no. And so if you do anything that shames the family name, you have all this guilt, and which then can lead to depression, and so and the anxiety of not performing and not doing well for the family, creates a whole lot of anxiety and depression together. So, but I think you have the Latino population, for sure. The statistics read that you have more women than men utilizing the services. Where I have seen men traditionally come in, and this is when, after it's usually drug and alcohol abuse. That's one that really brings them in. And interestingly enough, when there is either a divorce or, like with students, when there's a breakup in a relationship, the guys will be weak enough, and a friend will bring him in, or they'll finally realize, maybe I need to go talk to somebody. And so, the pain, the hurt from a breakup of a relationship brings a lot of males, and then when they get used to talking to somebody, especially if they, and here's a plug-in for having more Latino behavioral health therapists, is when a young guy can go and talk to another Latino and he can kind of speak their language and kind of understand where they're coming from and all that, they feel more comfortable. It's not like they're being diagnosed with some serious illness or not, but just really talk to them about what relationships are about, and how things really go, what life is really about, and how and just really kind of demystify what the whole issues of behavioral health issues and really spiritual health, which is what mental health is really about. What's really going on inside.
So, why are Latinos not receiving mental health treatment as often as it might be needed? Is it an issue of health insurance coverage? Could it be a language barrier? Or, as Dr. Silva stated, is it the issue of cultural stigma that is hurting the Latino population's mental health? Or could it be all of the above? Our guest is Fredrick Sandoval, Operations Manager for NLBHA, National Latino Behavioral Health Association. Fredrick, thank you very much for being here. Let's start the conversation discussing stigmas in the Latino community regarding mental health.
Well, Edmundo, thank you for having me, and great question. I think it probably gets right at one of the most significant challenges and barriers around mental health that face the Latino community. There's just three parts about stigma that's really significant. One we know is that there's a social stigma attached to having a mental illness, and there's a stigma attached to seeking help for mental illness. So that social pressure in of itself has a significant challenge for Latinos who seek care, seek help outside of their own natural helping systems. The other is self-stigma, where the individual starts to take in some of the challenges associated with their condition and how others view the person and how that person reacts. And there's something very unique about the Latino community that's not oftentimes talked about, and I refer to it as the double stigma. The stigma within the Latino community about its Latino members who suffer from mental illness versus the social stigma of the community at large. Because within our own barrios, our own neighborhoods, our own community, we have a whole set of different labels that we attach to a person that has a mental illness. I do a training that actually outlines that list of terms and stereotypes and labels that describe that. So it's unique in the Latino community because then the person has both of those elements to contend with, because one is that's within your neighborhood, within the barrio, within your community setting where you live, and then that's separate from the one that's really at large in play, because all people in society then experience stigma. So
As we look at stigmas, I've often heard in the barrios and in the community where you hear from first generation, they'll just say, "Está loco," just leave him alone. "Está loco," he's crazy. As we look at multi-generational
yes.
communities versus first generation, what are the stigmas differences that you frequently see that need to be discussed?
Well, I would say there's a few things that's very unique. One is we all learn something about mental illness from someone. And oftentimes we may not even really learn about those illnesses, and it almost feeds, if you will, into how we react to people who have these conditions, because we know little about them, what they are, what their symptoms are, the behavior of the person. We just know that there's something different about the person. Se está hablando, he's talking to himself, or he may in fact be reacting in ways that are very peculiar or odd. So our natural human reaction is to notice that there's something different. In the Latino community, clearly what happens is this, is we know that there's a protective factor about our children, if you will, who may have a mental illness. It's how to protect them and how to shelter them from the experiences that they may have by people who are noticing those differences. The family really surrounds the individual to help them in that way. At the same time, that doesn't mean that there's full understanding or education about this condition, schizophrenia, bipolar, terms that our families oftentimes are not familiar with. My sister suffers from schizophrenia. To this day, my mom, who's 93, doesn't use the word schizophrenia. Está enferma mi hija. My daughter is ill. So she knows, and very astutely, today, the literature is moving us to understand those conditions as an illness, just like other illnesses, diabetes, arthritis, cancer. So what's happening is the Latino community is in some ways ahead, right? My mom's 93, right? So she gets to describe it the way the psychiatrist would describe it, as an illness, as opposed to the other terminology, mi hija está loca, my daughter's crazy, because the stigmatizing term actually is contrary to her then learning about the illness. So it's very fascinating to see how that happens.
Well, as I conduct some of this research to study mental health in the Latino community, there just seems to be disparities and a high prevalence of mental health issues, and that are disproportionate when it comes to Latinos versus non-Latinos. Is this something that is just now being found out as the Latino population grows, or is this something that's always been the case?
Excellent question. I think it really, very pointed, it really gets at something that's very unique about the current state of affairs in the country. But I do think that your point about, has this been something that's been evident before? We know several things. There has been very limited research around the Latino mental health issues that the community and individuals experience. So there's been a shortage, a lack of research to help inform policymakers, decision makers. So in the absence of that, what's happened is the population has continued to grow at the fastest pace of any group in the country. We make up 16% of the country's population, in New Mexico 47%. So when you start to see how the numbers are starting to swell, anytime population numbers swell, so do the conditions or the health indicators of the population. what's unique in the Latino community, and you hit the nail right on the head by describing it, is the disparity. The disparity meaning that there's a greater proportion of those experiences that are happening above the percentage of the population. So for instance, if you have individuals in southern New Mexico or northern New Mexico that are having a greater prevalence of a condition, substance abuse, overdose circumstances, depression, anxiety, when it's higher than the general population, there clearly is evidence that there is something happening in those communities, in those individuals, that sometimes is not fully explained. And in the lack of the research, you could start to see that there's not much known about that. Because of the growth in the population, there is now starting to be a greater increase to start to say, so what is it about that population? And the content experts clearly are the Latino community, the families, the individuals who have served those particular communities. And it's a very telling moment in American history, because now the focus is starting to look in that direction, but it creates the opportunity for us to help build up a greater research base, and having a research base that not only includes Latinos in clinical trials and studies, but Latino researchers. So I think we have something really in a way that's an opportunity to look forward to, but in the meanwhile, there have been circumstances that have had very detrimental effects on our well-being.
Well, how does this affect the youth? I mean, how are you looking at the mental illness among youth? Again, you know, multi-generational versus first generational, and is it being treated?
This is a powerful question for several reasons. Because of the unique circumstances of that age group, that combined with what's unique with Latinos in the country, and in particular along the border area, is some of the acculturation stressors, some of the immigration-related issues, and the children who are here who are experiencing conditions and circumstances that are so uniquely different than other populations in the country. What we know is there's an underlying level of stress that is growing amongst the Latino youth. The age, of course, what we know is that, the adolescence period in of itself brings on, physiological changes. The youth are starting to kind of expand their borders in terms of how they can, control their lifestyles, the things that they're being influenced by, some of which are protective in nature and others which are risky in nature. You combine all of that in the Latino community, the question is, what positive, healthy outlets do kids have? The fewer, healthier outlets that the children have, it means that then those protective factors then are at risk of being affected by things such as what? The temptation to use more drugs, the temptations to actually get involved with gangs, and those pressures actually start to really cultivate a mental health reaction that's expressed through anger, hostility, depressed feelings of anxiousness, and the stressor buildup, if it's unmitigated, then starts to contribute to all of these confluences of things coming together, and the person being manifested by how they react to it, which may mean as they may drink a little too much, they might start experimenting and doing things in a way that are more detrimental to their well-being, all in the context of how does this relate to how my family reacts to my behavior.
Well, as you mentioned, a lot of those topics regarding gangs, drinking, in the current juvenile prison system, how is the juvenile system prepared, and do they understand that some of these Latino kids might be affected by mental health issues that they themselves, the kids, and the parents might not even know that are not diagnosed?
Well, it's a very significant point for several reasons. One is the juvenile justice system, and much like the criminal justice system for that matter, in some instances has started to be seen as almost the de facto treatment environment for kids with mental health illnesses that are diagnosed. In the community, when kids don't come in contact with the juvenile justice system for conditions that are untreated or undiagnosed, that starts to contribute to what it is that might result in criminal-like or delinquent-like behaviors. And the end result is this, is that it really speaks to an underlying problem in the country that's systemic. And then Latinos really get affected by it, and that is the absence of community-based mental health services to meet the needs of the communities before the conditions worsen. So, and what we do know in the communities is we know our kids are at risk for certain things, but in the absence of good research, the absence of a system that's really built up to help support our families, well, these conditions can only worsen. So the mitigation of them is critical, and I think the future might hold some possible hope. Because I don't want to see the situation as a hopeless condition. Como dice el dicho, la esperanza es la última para morir. Hope is the last to die. I think there's some incredible hope for us to look forward to in terms of how to build the community mental health system's capacity, but it'll have to involve the Latino community in terms of its input, its design, their participation in that process. Historically, that's been very minimal. I think that drive comes from community-based mental health communities and Hispanic provider agencies who know that, understand that, and that involve their families in that way for getting services. The larger system, which is really what's driving most of the financing and the programming, isn't quite there. So I think we have opportunities where we can demonstrate our leadership in showing how to effectively serve our communities based on the experience and knowledge we have.
Well, what kind of outreach is there today, that's out there for Latino communities to educate them about mental health and substance abuse? And, how is your organization helping provide this outreach?
There's a couple of things we know about outreach. It's actually one of the most significant pieces of engaging with the Latino community. And there are some organizations in the country that do this just incredibly well. And if anything, that probably can play into the strength of Latino organizations, because we know the community, we're the content experts, we're trusted. 3, we engage in the language that's appropriate for serving our families. And more importantly, we're grounded in the community. So there's a grassroots environment that can be easily cultivated. We recognize that Promotores is one of the most effective strategies of providing outreach and education, while it now, today, has received national prominence as an effective strategy for outreach. Well, the Latino community has known that for decades, but now it has received the attention that's appropriate, that due for its efforts. Yet at the same time, the question is then, how do we make that widespread as opposed to just within particular areas of the country? Because Latinos are not just found in one state, right? We know now that in fact Latinos are in every state of the country. And as a result of that, there are states that are experiencing triple-digit increases in Latino communities that they've never seen before. Arkansas, North Carolina.
Well, and again, that brings up to this question, with the explosive growth of, Latinos in the country, are psychiatrists and therapists, are they offered any type of training to deal with the Latino growth, which brings up another part of the question, language barriers that exist. Is there any training being offered to psychiatrists and therapists and perhaps even nurses that will understand and get through the language barriers?
Well, a couple of things that I would say, and I think here's where we could take tremendous pride, if you will, about in New Mexico, the New Mexico Board of Social Work Examiners, for instance, requires, as part of the whole licensing to become a social worker in New Mexico, to in fact participate in a cultural training to help ready you for serving communities in the state of New Mexico. And embedded in that is the core competencies around how to serve the diverse communities of New Mexico's population. So it's one example where it's in law, it's a public policy to actually train and prepare our social workers. The offshoot of that is the benefits counselors, therapists, peer specialists. So there's a really great example. In terms of the medical physicians, the psychiatrists, what we know is that wherever those training opportunities happen, they're probably not in an organized fashion, meaning that one, it's not instituted as public policy, it may not be part of the permanent higher education training model, but there have been attempts and efforts to do that. For instance, Senate Bill 600 that was passed probably almost a decade ago really attempted to look at how to ensure that the higher education curriculums and models were training and preparing psychiatrists to be able to ready themselves to learn about the diverse communities in New Mexico's population. It gained immediate traction, and then it kind of weathered out a little bit. So it's what happens. Some stuff works, some stuff starts, doesn't end, some stuff may still be at play, and some things have just never emerged. There's a proverb, and we love this one. It's one I used with the UNM residents. And the proverb, I said Spanish and English, tenle más miedo al médico que la enfermedad. Have more fear of the doctor than the illness. So it says something, and the physician residents kind of reacted very quickly to understand, well, why would the individual have fear of me more than the illness? So it really speaks to the challenges between physicians and Latino patients, right? We know that 1/3 of Latino patients have said, I have difficulties communicating with my doctor. There can be any number of things, including the basic fundamental notion of language preference.
Well, let me I mean, as we talk about language preference, and again about the cultural issues that may exist, do you see that the Latino community is the community more hesitant to take on medications that they so desperately need versus saying, well, maybe I'll try something traditional, and not take medications, thereby causing a bigger problem down the road?
Well, it's a complex matter. When we think of medications in the current example of prescribed medications, several things kind of crop up. One is we know this. Patients have to be pretty well informed about the symptoms and the reactions that they'll have to taking medications. When that's not fully explained, there's going to be some reluctance to really take the medication as prescribed. The person may recognize that it will attempt to address symptoms that they may have with sleeplessness or issues having to do with their state of anxiety. But there's something that's happening that's unique in Latino communities. One is 7 to 40% of Latinos engage in alternative medicine, what we call traditional healing. So it's happening separate from engaging with a physician or a doctor who may be prescribing that. And so we know, based on our traditions, our history, is we want to be able to use our traditional mechanisms, which is, maybe seeing la curandera, or maybe in fact seeing, guess what, our pastoral counselor, talking to our priest, visiting with our padrino, who always gives us the best advice, or in fact talking to our compadres, the people who we trust about these situations that we can share to talk about our personal health information in a private way. All of that at the same time as doing what? Getting the advice of a physician. But we do that in a way that's very cautious, if I can say it that way, largely because one is, we know that in fact, the number of prescriptions that are issued, the question might be is that something that's palatable, acceptable to us, because we're informed about what the implications are from taking the treatment.
Let's talk about an explosive issue, the undocumented immigrant front.
Yes.
Is there any research on how mental health may be affecting this community?
Excellent question. And this is something that seems to be universally understood in the country here in the United States, is that the longer that immigrant populations stay in the United States, the more their health condition worsens. So this is something that there seems to be a pretty mutual understanding about, which is that for immigrant populations as a whole, and of which we know that the largest percentage is populations of the Latino countries of origin, this is what's going to happen, is that it really says something about their health status in their countries of origin, is that if those conditions worsen as a result of coming to the U.S. and staying here for a longer period of time, several things start to happen. One is the very same health conditions that exist for Americans and Latinos who have lived here for a longer period of time, now those become almost a significant factor in their exposure to circumstances that really contribute to their illness and disorders. We know, for instance, that binge drinking, for instance, when you compare it between immigrants that have been here for longer periods of time versus those that have, there'll be challenges for people who have recently come here to understand that one is that the substance abuse drinking patterns in the United States are different than they are in Mexico, for instance. So those exposures to American traditions, habits, behaviors, and influences about the consumption of alcohol are vastly different than they are in their traditional communities.
Well, what are some current effective prevention practices in the Latino community that may exist and are practiced and that are being effective?
Great question. I'd say a couple of things about that. There are programs, there are practices that are effective in terms of prevention and even treatment for Latino communities. But I would say this first and foremost is because they're in a small minority, what happens is they probably don't get as much of the attention or they may not be as widely known as they could be or should be. There's a national registry called the National Registry of Evidence-Based Practices and Prevention Programs. And if you look at that list, very few of them were actually normed or developed for Latino communities. So the science says that they work and they have productive outcomes and results. So we've had an attempt at NLBHA to actually look at those very practices. And we've developed a research arm called the Community Defined Evidence Practice. And it actually looks at the research around which practices have been effective. There's one here in Las Cruces, in fact, called Strengthening Families, for instance. Very effective. It's an evidence-based practice, but it was adapted in a way that's unique to the Latino communities. The traditional prevention specialists, in this instance here in Las Cruces, what we use as the staffing were promotoras who were trained in that function and role. So you take trusted, well-known community agents, if you will, people who work naturally with the community, individuals who are respected and trusted, but train them in these models. It was a nice adaptation to be able to implement a program that can show improved results. For instance, less consumption of alcohol, more communication with the parents, lesser stressors at school, greater attendance at school. So there's a model like that, a couple of others that are just phenomenal. Familia Adelante is a prevention program designed explicitly to address the conditions in Latino families, the prevention program.
Well, where can people look or families look at, where they can find, okay, here are some symptoms of my child might having, a mental illness, or not just their child, but, somebody in their family. I mean, in a nutshell, where can people go to get this kind of information?
Well, it's a great question because it's a question of access. People access information differently. And what we're very accustomed to and doing very comfortably is accessing it in an oral way. So I think a good place actually to start with is typically two environments, because we have a lot of contact with them. School settings, which is that the school nurse, the school counselors, or even the teachers, because they have access to that information to bring to bear to parents, because it's a setting that parents have contact with. The other is the community health centers, or the community-based organizations in the community, because they have access that they can give to the parents about, here's things to look for in terms of behaviors or symptoms or characteristics to help inform. So those existing places have them. There's one portal that's going to give all the answers to all the key questions, but our organization can assist with those kinds of things for folks who would have access to computers and internet, because not everybody does, right?
Well, thank you very much, Fredrick Sandoval, from Operations Manager for NLBHA, the National Latino Behavioral Health Association. You can learn more at nlbha.org. Thank you for watching Fronteras, A Changing America. Today's program, From Stigma to Treatment, Latinos and Mental Health. I'm Edmundo Resendez.